Hello, my name is Dr. Gordon Wilson, and today I want to talk to you about gum disease. We're going to talk about what it is, we're going to talk about how you get it, we're going to talk about once you've gotten it, how do you get rid of it, and then most importantly, once it's gone, how do you prevent it from ever coming back again so that you never have to deal with this ever again? Okay, so let me start by sharing my screen. Your mouth is the perfect incubator for bacteria. It's warm, it's dark, and it's moist. Every time you eat, you provide that bacteria all the nutrients that it needs to multiply and spread throughout your whole mouth. Now, it's been said that we have anywhere from 500 to 1,000 different types of bacteria in the human mouth. And these bacteria are duplicating exponentially every 17 to 20 minutes. To put that into perspective, what that means is if you had one single bacterium and it were to double every 17 to 20 minutes, within 24 hours, that one single bacterium is now 5,000 billion bacteria. That's 5 with 21 zeros behind it. You take that number, you multiply it by the 500 to 1,000 different types of bacteria that we have in our mouth, and you can see that you've got a lot of bugs in your mouth. Now, for the good news, the vast majority of the bacteria in your mouth are helpful. Only a small percentage of them are harmful. And what we do is we categorize these bacteria as aerobic and anaerobic. So an aerobic organism is like you and me. Aerobic organisms thrive in an oxygen-rich environment. We need oxygen in order to survive. If you cut our oxygen supply off, we will die. Well, anaerobic organisms are the exact opposite. Anaerobic organisms thrive in the absence of oxygen. They do not need oxygen to survive. And a good way to kill an anaerobic organism is to give it oxygen. So it just so happens that the further down below the gum line you go, the less oxygen there is. Therefore, the nastier these anaerobic bacteria are, and our treatment of choice in this office is called oxygen therapy. So, when the bacteria in your mouth combine with leftover food particles from a meal, it forms the sticky stuff that we call plaque, as you can see in this picture right here. Plaque is constantly forming on your teeth. This is the stuff that you are supposed to remove every day with your toothbrush bristles and your floss, because if you do not remove it, if you leave it there for an extended period of time, eventually the minerals in your saliva will harden this plaque and turn it into what we call calculus. And another name for calculus is tartar. Once this forms on your teeth, now you're in trouble. There is no toothbrush on this planet, there is no floss on this planet that will ever get calculus off the roots of your teeth. Coincidentally, we use the terms calculus and tartar interchangeably. They both mean the exact same thing. So let me show you what happens when calculus forms on your tooth. Here we have a tooth. It consists of the crown right here and then the root down here. Where the crown and the root come together right there is called the neck of the tooth. So in a healthy mouth, our gum tissues are tight around the neck of the tooth and the bone levels come up higher on the neck of the tooth. Right here, between our teeth and gums, there's a little gap, a little valley that goes all the way around every single tooth. And what we do is we call this area a sulcus. We measure this sulcus from what we call the crest of the gingiva right there down to where it attaches to the root of the tooth. And ideally, we want that measurement to be 3 millimeters or less. Once it hits 4 millimeters, we stop calling it a sulcus, and now we call it a pocket. So pockets are bad. We need to eliminate pockets, and we have different types of pocket elimination therapy that we'll be discussing as well. So the reason that calculus forms on your tooth is because when you brush and floss, the bristles of your toothbrush and your floss can only get about 1 millimeter below the gum line. So in this second and third millimeter right here, this is where that tartar starts to form. And once it forms, it releases toxins and poisons into the gum tissues. And they go from being tight, pink, and healthy, like you see in this image right here, to being red, puffy, and swollen, like you see right here. This is gingivitis. Gingivitis is the first stage of this so-called disease. It's the only stage that's 100% reversible because at this point, you've had no bone loss. If you ignore gingivitis, it never gets better on its own. It only continues to get worse over time. And what happens is that calculus keeps creeping further and further down that root surface. it releases more and more toxins and poisons into the environment, and then you end up getting bone loss. Now you've developed what's called periodontitis. So if you ignore periodontitis, it also never gets better on its own. It only continues to get worse over time. That calculus keeps creeping further and further down the root. You release more and more toxins and poisons into the environment. You get more and more bone loss. Eventually, there's so much bone loss that either the tooth falls out on its own or it needs to be extracted. Periodontitis is the number one cause of tooth loss. So, what do we do? Well, the most important thing that you can learn here today is this. Treating this condition, whether it's gingivitis or periodontitis, is exactly the same. Number one, we need to remove the tartar from the roots of the teeth. And number two, we need to prevent that tartar from reforming on the roots of the teeth. It's just that simple. Unfortunately, it's much easier said than it is done. It is the dental professional's job to remove the calculus from the roots of the teeth. It's your job to prevent it from reforming. Your job is way more difficult than our job, and your job is way more important than our job. So we're going to perform a procedure called non-surgical pocket reduction. And typically, what happens with non-surgical pocket reduction is we will anesthetize the gums, either with a gel that anesthetizes the gums only, or we may use an anesthetic like lidocaine or something like that, as if you have a filling or a crown. And the goal is to get you numb enough that we can get down on that root surface and get all of that calculus off the root. We want to make it so smooth that no more toxins and poisons can be released into the gum tissues. The gums will then reattach, the swelling will subside, and your gums go right back to being healthy again for about 12 to 72 hours. So think about the last time that you had your teeth cleaned. You know that amazing feeling that you get when you run your tongue over your teeth after they've just been professionally cleaned? How long does that amazing feeling last? About a day or so? That's because as soon as you eat, you begin to form plaque. That plaque begins to turn into calculus within 12 to 72 hours. Within a week to 2 weeks, that calculus is fully hardened and you have to go back in and get your teeth cleaned again. But who do you know that's going to go get their teeth cleaned every 2 to 3 weeks? Nobody, right? So, non-surgical pocket reduction, like what I just showed you here, is effective for shallow pockets, the 4 millimeters, the 5 millimeters, even the occasional 6 millimeter pocket. But once we start getting into multiple 6s and 7s and 8s and so forth, now all of a sudden, non-surgical pocket reduction is not as effective. And typically what happens is you get sent to a periodontist for what's called surgical pocket reduction. Now, I need to warn you, this next video has some images in it that might be disturbing to some of our viewers. So if you have children present or if the sight of blood makes you queasy, then you may want to avert your eyes for a second. But with surgical pocket reduction, what happens is the surgeon will make an incision along the gum line. He will then peel the gums away from the root of the tooth and the bone so that he can get better access to the roots of the teeth. He will then go in and scale and root planing. You see a little piece of calculus coming off of there. They then go in with their scissors and cut away any excess tissue. And lastly, they suture everything together. Now, in 2003, the World Health Organization released a publication that said approximately 85% of adult Americans aged 30 and above have either gingivitis or periodontitis. And about half of those people need to have surgical pocket reduction like you see right here. To put that into perspective, that's about 75 million people every year that need this surgical pocket reduction. In 1997, UCLA did a study and they found that only about 3% of people, when given the option for surgical pocket reduction, say yes to it. Essentially, what those other 97% are saying is, thanks, but no thanks. I'd rather lose my teeth than go through that, because that's exactly what's going to happen if you don't do something about this problem. You're going to lose your teeth. So in 1998, I became one of the first 4 dentists in the world licensed to do the only procedure in dentistry that's ever been patented. And what it does is it utilizes a laser in lieu of the scalpel and stitches. What my laser does is it selectively separates the diseased gum tissue from the healthy gum tissue, leaving the healthy gum tissue perfectly intact, yet still giving me enough room to go in and do my root planing. After the root planing, we make a second pass of the laser. And what the second pass of the laser does is it warms up the blood so that the blood becomes sticky, and now the gum tissues will stick to the root of the tooth. So, when given the option between this procedure and this procedure, which would you pick? People choose the laser for many reasons, mostly because it is minimally invasive. Because it is minimally invasive, there is little to no trauma to the gum tissue. Because there's little to no trauma to the gum tissue, there's going to be little to no swelling of the gum tissue. And swelling causes pain. So because there's little to no swelling, there's going to be little to no pain. We also have faster healing times. But the problem with my laser is that I can have 3 patients identical to Chip here. I can do this exact same procedure to all 3 patients. And one of those patients will get amazing results. The next person will get mediocre results. And the final person will get horrible results. And for the longest time, it drove me crazy trying to figure out what I must be doing wrong. As it turns out, the reason that some people get amazing results, some people get mediocre results, and some people get horrible results is because of what I told you earlier. The most important thing that you can learn here today. That is, A, remove the calculus, B, prevent the calculus from reforming. I knew that I was doing an amazing job of removing the tartar from the roots of the teeth. But those patients with the amazing results had amazing home care. They did an amazing job of preventing that tartar from reforming on the roots of their teeth. The people with the mediocre results had mediocre home care, and the people with the horrible results had horrible home care and a horrible attitude to go along with it. So, what I soon realized was I need to get everybody on the same page at home with their home care because I want everybody to have amazing results. So I started taking a look at what you've been taught your whole life. You've been taught tartar control your whole life. You've been told that you should let that food and let that bacteria form on your teeth to make plaque. Then you're taught that you need to go in there with your toothbrush bristles and your floss to get all of that plaque off of there before it has a chance to turn into calculus. And unfortunately, it doesn't work. If it did work, we wouldn't have the epidemic that we have of 85% of adult Americans with either gingivitis or periodontitis. So let me show you what brushing and flossing does for you. Brushing does an amazing job of removing the plaque from the crowns of the teeth. Flossing does an effective job of removing the plaque from in between the crowns of the teeth. Neither brushing nor flossing do anything for the roots of the teeth, and that's where this problem is. Because when you brush and when you floss, you can only get about 1 millimeter below the gum line. If you've got a 5 millimeter pocket and you're only reaching 1 millimeter below the gum line, you're now missing 80% of the plaque that's on the root of your tooth. Within 12 to 72 hours, that plaque starts to harden and turn into tartar. Within a week to 2 weeks, that tartar is fully hardened and you're just spinning your wheels at that point. So I knew that tartar was the cause of the problem. So one day I asked myself, well, what is tartar? It's calcified plaque. And what is plaque? It's food and bacteria combined. So then I asked myself, what if we had something to eliminate all the food particles after a meal and something else to kill all the bacteria? Because if there's no food and there's no bacteria, then there can be no plaque. If there's no plaque, there's no chance for tartar. And if there's no tartar, there's no problem. So that's when I developed the TLC Home Care Method of plaque control. And now everybody gets amazing results. So what is the TLC Home Care Method of plaque control? We use what's called the HydroFloss to flush out all the food particles after a meal. This is like a water pick on steroids. If you've ever used any kind of oral irrigator before, you know that it does a pretty effective job of flushing out all the food particles. But the difference between this and all the other oral irrigators on the market is that right here in the handle, there is a magnet. And when that water passes through that magnet, the magnet ionizes the water, giving the water the same electrical charge as the bacteria, and like charges repel. So this flushes out all the food particles the way any other oral irrigator does. But this repels bacteria in a way that no other oral irrigator can. Next, we want to kill the bacteria. And for that, we use what are known as the Perio Trays. So here I have an example of a Perio tray. Let me show you how these trays work. This truly has been the reason that we are so successful in my office. Here we have a tooth that consists of a crown, and the outer layer of that crown is made of enamel. Then we have the dentin, and then we have the pulp. So here's our pocket, here's our gums, here's our bone. Here's our bacteria in the form of what we call a biofilm. And these bacteria have irritated the gums. They've become infected and swollen. That's what the itis is at the end of gingivitis and periodontitis. It means inflammation. So these gums are irritated and inflamed and infected and swollen. So what we're most concerned about is this area right here. And I want to zoom in on that area right now. There we have our enamel. There's our dentin. Here's our pulp. Here's our pocket. Here's our gums. Here's our bone. When you brush and floss, the bristles of your toothbrush and your floss can very easily remove all of this bacteria up here. But the problem is you cannot reach this bacteria down here. Now, you've known since you were a child. If you leave that bacteria on that tooth, eventually this bacteria is going to eat right through that tooth, causing a cavity, correct? Well, enamel is the hardest substance in your body, followed by dentin, followed by bone. This is soft tissue like your skin. So the question now becomes, if this bacteria right here can eat through enamel and eat through dentin and eat through bone, do you think this bacteria right here can eat through your gum tissue? The answer is yes, it can, and yes, it does. Now, notice this about our gum tissue. We have two separate layers. This outer layer is what we call the epithelium. This inner layer is called the lamina propria. The lamina propria is where the blood vessels are. So the lamina propria supplies nutrition to the epithelium. When you saw me using my laser on Chip in that earlier video, my laser was separating this epithelial layer from this underlying lamina propria layer. When that periodontist was using his scalpel, he was cutting all the way down to the bone. That's why his procedure was so bloody, because he was cutting into the lamina propria, and my procedure was not bloody at first because I was not touching the lamina propria. Notice this about our epithelium. Outside the pocket, the epithelial lining is very, very thick. But as we come over this gingival crest and down into that pocket, our epithelial lining gets thinner and thinner and thinner. In fact, at the base of that pocket, your epithelial lining is only 1 to maybe 2 cell layers thick. That means that this bacteria right here only has to eat through 1 or 2 cell layers before it's in your bloodstream. Now it starts coursing throughout your whole body, going to all your major organs. And this is why over the last 20 to 30 years or so, you keep reading about and hearing about how gum disease has been linked to heart disease, diabetes, and stroke, and all these other things. It's because you now have a direct communication between your periodontal pocket and your bloodstream. So our goal is to kill this bacteria down here. And that's not easy to do because your body is producing this saliva-like fluid that we call crevicular flow. And when you have an increased infection, you have an increased crevicular flow rate. It's almost like taking a garden hose and pinching it, and the water comes out more forcefully. So the dilemma that we're now faced with is, how do we overcome the hydraulic pressure of this crevicular flow to get something down to the bottom of the pocket to kill that bacteria? And that's where our Perio Trays come in. What we do is we take an impression of your teeth and we send it to our lab in St. Louis, where they custom fabricate a set of these trays to fit your mouth and your mouth alone. You're going to put a medicated gel in the tray. You're going to put the tray in your mouth and you're going to wear it for 15 minutes. And here's what happens. Our little blue line right here, this indicates how far down below the gum line the bristles of your toothbrush reach and how far down below the gum line your floss reaches. So when you brush and floss, you can effectively remove everything above that blue line, but you cannot reach anything below that blue line. What the lab does is they create a little reservoir here for that medicated gel to go into. They create a ledge here, they create an extension here. So when this part of the tray comes in contact with your gum tissues, it's going to create an airtight seal, preventing any of this medication from escaping. Now, as you bring that tray down over your teeth and gums, you trap air inside that reservoir there. And when this tray is fully seated and that seal is fully engaged, the air pressure inside this chamber is now 6.5 times greater than the hydraulic pressure of that crevicular flow coming out of there. So that's now going to push that medication all the way down to the bottom of the pocket, well beyond the reach of your toothbrush bristles and your floss. And after 15 minutes of wear time, you kill 99% of the anaerobic bacteria that cause tooth decay and 99% of the anaerobic bacteria that cause gum decay. And in my office, we prefer to call this gum decay instead of gum disease because your gums aren't sick. When you look at the human body's immune response to this so-called gum disease, it is the exact same immune response that the body has to an open, festering wound. And that makes complete sense because if I were to cut the gums out of your mouth and lay them on the counter here beside me, they'd be about the surface area of the palm of your hand, or about 9 square inches. So imagine if you had an area on your thigh that was about 9 square inches where the bacteria were just continually eating away at the skin on your legs. Would you tell everybody that you had leg disease, or would you say you have a leg wound? This is a wound. How do you treat a wound? Well, number one, if there's any diseased or dead skin, you remove the diseased or dead skin. What does my laser do? It removes the diseased or dead skin. Number two, you want to remove the foreign objects from the wound. Well, the calculus on the roots of the teeth are foreign objects. We need to get them out of there and clean all that stuff out of there. Number three, you want to irrigate that wound thoroughly. I don't know if you notice it or not, but our piezo scalers have water coming off of them. So as we're removing the calculus from the roots of the teeth, we are simultaneously irrigating. Number four, you want to ensure that that wound bed remains moist. Well, this is your mouth. You've got saliva, you've got crevicular flow. It's already moist, so we don't have to do anything for step number four. But step number five, and most importantly, is you need to ensure that that wound bed gets plenty of oxygen. And that's what these trays are doing, because this medication inside this tray is H2O2, water with an extra oxygen molecule, commonly known as hydrogen peroxide. Now, if you've ever put hydrogen peroxide on a wound before, you notice that it effervesces. Well, that's because there's an enzyme in your blood called catalase. And when hydrogen peroxide comes in contact with catalase, the catalase breaks that hydrogen peroxide down into its two main constituents, which are water and oxygen. So the bubbles that you see coming from that hydrogen peroxide are actually the oxygen molecules escaping from the water compound. It is the oxygen then that kills these bacteria because they are anaerobic and they cannot survive in oxygen. Now, a side effect to these trays is that they will whiten your teeth. We call this a side effect and not a benefit because if you have a front tooth that has a crown or a veneer or a large filling, that restoration will not whiten, but the rest of your teeth will. So every once in a while, our patients' teeth get so white that we have to replace their old yellow dingy fillings and restorations on their front teeth. Now, you might be asking yourself, why can't I just swish with hydrogen peroxide? Well, there are several reasons why you shouldn't. The main reason is because the stuff that you have at home in your medicine cabinet in the brown bottle, that has stabilizers in it. Those stabilizers are not safe for human consumption, all right? Now, a lot of people will say, well, I don't drink it, I don't swallow it. Yes, but your tissues will absorb it, so it's not safe. So don't use the stuff in the brown bottle. You can actually purchase from a Whole Foods or a Sprouts or some kind of natural food place like that. You can get food grade hydrogen peroxide sold at 3%, okay? 3% food grade hydrogen peroxide, and you can swish with that. But again, the problem is it cannot get down inside that pocket because that crevicular flow will prevent it from doing so, all right? The stuff that we're using in these Perio trays, this is a 1.5 to 1.7% food grade hydrogen peroxide. So the HydroFloss flushes out all the food particles. The Perio trays kill all the bacteria. If there's no food and there's no bacteria, there can be no plaque. If there's no plaque, there's no calculus. And if there's no tartar, there's no problem. Our patients state that they feel like their teeth have just been professionally cleaned every single day when they wear these trays. Now, if you'd like to schedule a free, no obligation consultation with me, simply click on the link below and you'll be directed to a page that will help you select a time that best works for you. And I'd be happy to answer any further questions that you might have. And I look forward to meeting you.